Hello friends, welcome to Kavita Medicos Education, and today's disease condition is IBD. IBD means Inflammatory Bowel Disease. Now let's break the term. Inflammatory means there is an inflammation, swelling or lesion formation into the bowel area. Bowel is our intestine area. Okay, so it's an inflammatory disease condition of our intestine area. Okay, that is known as Inflammatory Bowel Disease or IBD. Now let's see the definition. Inflammatory bowel disease is a chronic condition. Okay, it's a chronic condition. Okay, this is not an acute disease condition, but it is a long lasting or chronic disease condition which is characterized by, okay, what are the features of this disease condition? So it's an ongoing inflammation, so there will be swelling, ulcer formation. Okay, it's an ongoing process of inflammation into our GIT tract. Okay, so this disease condition will take place into our GIT tract, that is our gut system. So our GIT tract start from our mouth and up to the anus. Okay, so this is our GIT tract. So this disease condition can take at any area of our GIT tract. Okay, with what will happen in this disease condition? There will be redness, okay, there will be swelling, and there will be ulcer and lesion formation. Okay, basically our immunity, our immune cells are attacking our own gut. Okay, our own immunity is attacking our own healthy cell and tissue. Okay, so that's why this disease condition takes place. What is the main reason for this IBD? So the main cause or risk factor for this IBD is our immunity. Okay, when our immunity misconceptionally they take our healthy tissue or a healthy cell as an antigen. Okay, and they will attack to our own body tissue, then this IBD disease condition will generate or develop. Okay, so it's a ongoing destruction of our cell and tissue of our gut. Okay, so this IBD is a group of disease condition. Okay, so there are some points which you have to remember. First, it's a chronic disease condition. Okay, it is a long lasting disease condition which will take place into our GIT tract. Okay, and it will do the inflammation, redness, swelling, ulcer and lesion formation into our gut system. And what is the main causative agent for this disease condition? So the main causative agent for this disease condition is our own immunity. Okay, our own immune cell will attack our healthy tissue or healthy gut system, and there will be inflammation into our gut system. So IBD is divided into two types. Okay, so there are two categories of IBD. First we have ulcerative colitis, and next we have Crohn's disease. Okay, so there are two types of IBD. So we will study this by one. Okay, so first I am going to tell about ulcerative colitis. So what is ulcerative colitis? So before going to read about the ulcerative colitis, just see the diagram of the large intestine, because this disease condition takes place into the large intestine area only. Okay, so all the anatomy is very important. Okay, so all the anatomy of our body is very important if you are reading any disease condition. So in ulcerative colitis, this disease condition will take place into our large intestine area only. Okay, so these are the parts of our large intestine. So let's discuss these parts. So first we have cecum part, and below the cecum we have appendix, that is known as vermiform appendix. Okay, that is our vestile organ. Okay, it's a vestile organ. Then we have cecum, and then we have colon region. First we have ascending colon, then we have transverse colon, then we have descending colon, then we have sigmoid colon, and at the last we have rectum area where the stool get accumulated, and at the last we have anus region. So why we are studying this anatomy? Because this ulcerative colitis disease condition takes place only in the large intestine. Okay, ulcerative colitis will affect our large intestine area only. So now let's see the definition. Inflammatory bowel disease characterized by mucosal inflammation of rectum, colon and cecum. So there will be inflammation of our mucosal layer. So there are 4 layers in our GIT. Okay, gastrointestinal have 4 layers. What are those layers? First we have mucosal layer, then we have submucosa, then we have muscularis propria, and then we have serosa layer. Okay, so these are our 4 layer of our GIT. Okay, so there is a inflammation, there is a lesion formation into the mucosal layer. Okay, so mainly in ulcerative colitis, this disease condition will take place into the rectum area. Okay, so rectum is always involved in the ulcerative colitis. Just remember this point. Okay, see the diagram. Here I have shown the inflammation of the rectum. Okay, now this disease condition will affect our whole intestine, that is our large intestine. Okay, so it will do a inflammation, it will do a lesion into our rectum area. Okay, then into the colon area, then in the cecum. It means whole intestine is get affected by this disease condition. Next point, there is a continuous rectum lesions from rectum to proximal. Now this lesion or this ulcer formation will go towards the proximal. Proximal means it is going from rectum towards the cecum area. Okay, so it will be a continuous lesion which is moving forward, which is moving proximally from the rectum to the cecum area. So there is no gap in between that. Okay, this ulcer or lesion will take place continuously into our large intestine. Okay, so there is a lesion and inflammation which is going from our rectum to the cecum area. So it's a proximal lesion formation. Next point, inflammation limited to mucosa and submucosa. Now we have 4 layers, but here the inflammation, okay, and the lesion will only affect our 2 layers, that are mucosa and submucosa. So our 2 layers are getting affected. Okay, it is not going very deep into our muscularis propria and serosa. So the ulcer is superficially, means it is affecting our mucosa and submucosa layer only. So this ulcer will do a inflammation into mucosa and submucosa. It's a limited type of inflammation because it is not affecting the 4 layers. Okay, so it's a limited type of ulceration or inflammation. Next point, mucosa shows superficial ulcer. Superficial means because this ulcer is not very deep, so this ulcer will appear into the mucosa layer, that is superficially we can see this ulcer by the endoscopy or by colonoscopy. Okay, so when we will do the diagnostic procedure, okay, when we will do the endoscopy, colonoscopy, then this ulcer will be seen as a superficial ulcer. Okay, because this ulcer is appearing into the 2 layers only, that is why it is known as superficial ulcer. Next we have intervening intact mucosa may form inflammatory pseudopolyp. Okay, what is pseudopolyp? Pseudopolyp means a false tumor. It's not a tumor, but it's a false tumor. Why pseudopolyp is occurring here? See, when the ulcer will go deep into our layer, then what will happen? The layer of mucosa which is in between the ulcer, it will get swell. Okay, it will get swell because IBD is a type of disease condition which have 2 phases. One, it have exacerbation phase. Exacerbation phase means when the disease will go at its peak level, that is known as exacerbation phase. And next we have remitting phase. Remitting means when the disease will come down, okay, when patient will feel very healthy, okay, and all the ulcer, all the inflammation and lesion will disappear. That is known as remitting phase or relaxing phase. You can say that relaxing phase means sometimes the ulcer will appear and sometimes what will happen, the ulcer will disappear. Okay, so it have 2 phases. One is exacerbation phase and other one is remitting phase. Exacerbation means the peak level of disease and remitting means when the disease will go away. That is known as remitting or relaxing phase. Okay, so due to this flare up, okay, due to this flare of remitting and relaxing, what is happening? The mucosa is getting swell. Okay, and again this mucosa will heal. After some time it will heal, then again it will swell and again it will heal. So this process will go on and on. So what will happen? A polyp will form here, that is known as pseudopolyp. Okay, so pseudopolyp means it's a false type of tumor formation. Now let's see next point. There is no fissure, there is no fistula. Inflammation will continue neutrophils, lymphocytes and crypt. Okay, so by this you can judge. Okay, I will draw a diagram here for you. So here we have layers. Okay, so these are 4 layers. Now what I have told that this ulcer is going into the 2 layers only, means it will appear into the mucosa and submucosa. It is not going deeply. So how the fissure will form? So no fissure and no fistula and no sinuses is seen in ulcerative colitis. Just remember this point very clearly, that if ulcer is in the superficial layer, it is not very deep, then there will be no fistula formation. Fistula means when there is an abnormal connection in between the two organs, that is known as fistula. Okay, so in ulcerative colitis, patient will have no fistula, he will have no fissure, and there will be crypt formation. This is very important point for exam. Okay, so this question is asked in the MCQs. It's a main question, that in ulcerative colitis, what type of abscess formation take place? So in ulcerative colitis, crypt abscess formation take place. So what are crypt? So we have intestine in this way. Okay, here I am drawing a diagram. So these elevated area are known as villi. So villi are the finger-like projection which will absorb the nutrition from the blood, that is known as villi. And this downward is known as crypt formation. Again we have villi and again we have crypt. Next we have villi, next we have crypt. So this is a continuous formation. It's a wave-like formation. Okay, it's a wave-like formation. We have here we have mucosa layer and here we have submucosa layer. So this crypt are in our submucosa layer. So what will happen in this crypt? When our immunity or when our immune cell will attack to our body, then most of the neutrophils, mostly the neutrophils get accumulated in the ulcerative colitis. Okay, so most of the neutrophils will get accumulated into this crypt. Okay, and some lymphocytes or T cell or WBCs can also be accumulated, but the more quantity, okay, more quantity is of neutrophils. So more and more neutrophils get accumulated into this crypt area, and there will be pus collection, that is known as crypt abscess. So this crypt abscess can be seen only in ulcerative colitis. Okay, so this was about ulcerative colitis. Now let's come to the Crohn's disease. Okay, so this is a part of IBD. So now we have Crohn's disease. So what is Crohn's disease? So it's an inflammatory bowel disease condition which can affect any part of our GIT. Means it can happen anywhere into our GIT, from the mouth to the anus. Okay, from gum to the bum area. Okay, so it can happen into any area of our GIT. So mouth to anus, but most commonly involves small bowel. But mostly this Crohn's disease will affect our small intestine area. So just remember the anatomy of our intestine. Okay, so we have three parts of our small intestine. First we have duodenum part, next we have jejunum part, and next we have ileum part. So what is the last part? You can see the diagram. Okay, here I have drawn a diagram. So here the last part of our ileum is our terminal ileum. Okay, that is the last part. So mostly this Crohn's disease condition will affect our terminal ileum, and sometimes it can also affect our cecum area. Okay, that is a part of our large intestine. So we have three parts of our small intestine. First we have duodenum, then we have jejunum, and then we have ileum. So mainly Crohn's can happen anywhere into our GIT, but mostly or most commonly it will affect our terminal ileum, that is the last part of our ileum. Okay, at the last part of our ileum it will affect. Next we have skip lesions. What are skip lesions? Skip lesion means that some areas are involved in the disease. Okay, then some area will remain healthy. Okay, then again this part will be affected and this part will be not affected. Okay, then this skip lesion means some areas are involved. It is in a gap like formation, means patient will have an ulcer here, then this area will be healthy. Okay, then he will have ulcer here and this area will be healthy. So it's a skip like formation, means there are some inflammation area, there are some lesions area, then in between that we have healthy area, we have healthy tissue, then again this disease will skip into other part. It is not a continuous disease condition. It is not going continuously. It is going in a skip formation, into a skip lesion formation, that is in a gap form. Okay, next we have transmural inflammation. Transmural means when all the layers of our GIT get affected. Okay, now see, this is our 4 layers. Transmural means when this ulcer will go deeply into the 4 layer, that is known as transmural. Means when this ulcer will affect all the 4 layers of our GIT, that is known as transmural inflammation. So this ulcer will affect our mucosa, submucosa, muscularis propria and serosa. Okay, so it will go deeply into our all the 4 layer, that is known as transmural inflammation. Next we have fissure and deep ulcer. So see, when this ulcer is going longitudinally into our all the 4 layer, then it will form a fissure. Fissure means this ulcer will penetrate from this bowel area to the other bowel area, and it will connect, it will make a connection in between the bowel. Okay, that is known as fistula. So a fissure formation, a fistula formation and a sinuses formation will take place into the Crohn's disease condition, because this ulcer is penetrating or going in a longitudinal form into our 4 layer. Okay, it is deeply involved into our 4 layer, so it will make a fissure, it will make a fistula here. Next we have serpiginous ulcer. Serpiginous means the ulcer which will appear like a snake, that is known as serpent. Serpent means, what is serpent? Serpent means snake. Okay, so the ulcer can be seen as a serpiginous ulcer. Why? See, when the ulcer will happen here, okay, suppose this is ulcer and it is going deeply, then it will appear like a snake appearance. Okay, so it is known as serpentiginous ulcer. Next we have cobalt stone appearance. Cobalt stone means a bumpy stone road. We have seen in old movies or in old days when the roads were made up of stones, that is known as cobalt road. Okay, you have seen in the old movies that we have a cobalt type of road. So similarly, there is a cobalt stone appearance. How this cobalt get formed here? See, when this ulcer is going longitudinally in this fashion, okay, so what is happening in between the 2 ulcer, the mucosa will get swell. Okay, in between the 2 ulcer, the mucosa will get swell because this ulcer is in a skip lesion form. So in between the 2 ulcer, when the mucosa will get swell, so it will appear like a cobalt stone. Okay, next we have intestinal wall thickened and become narrowed. Here in Crohn's disease, intestine wall will get thick. Okay, it will get swallow. Okay, there will be swelling in the intestine wall, and the lumen or the free space in the intestine will get narrow. That is known as Crohn's disease condition. Whereas in ulcerative colitis, what will happen? The intestine will get swell and the inner lumen space will get widen. Okay, it will get broader. In this condition, in this ulcerative colitis, the space will get broad, but in Crohn's disease, the lumen space will get narrow due to swelling and thickness into our bowel. Okay, so this was the definition of IBD and types of IBD. Next we have etiology and risk factor of inflammatory bowel disease. Okay, what is the cause for inflammatory bowel disease? So first cause we have genetic factor. Okay, so certain genes regulate the immune system and intestinal protection. Okay, so there are certain genes in chromosome which helps in the regulation of our immune system. Okay, which will regulate our immune system. Okay, and they also help in the intestinal protection. Okay, they protect the intestinal lining from leaking. Okay, so if there is any genetic mutation or there is a genetic change, then what will happen? These genes will not able to regulate the immune system and our immune system will get hyperactive. Okay, and this hyperactive immune system will damage our intestinal lining. Okay, so if there is a gene mutation or genetic changes, they will increase the chances of inflammatory bowel disease around 10%. Okay, 5 to 10%. So in Crohn's disease, it is seen that genes play a major role in Crohn's disease. Okay, and less in ulcerative colitis. Okay, so example, we have genes like NOD2 genes and interleukins 23 receptors. Next factor we have autoimmune reaction, that is immune system dysfunction. So we all heard about autoimmune reaction. In this reaction, what happens? Our own immunity attacks our own body. Okay, and they damage our own healthy cell and tissue and leads to inflammatory bowel disease condition. So when our immune system will attack our own gut cell and tissue, then what will happen? the immune mediated reaction will take place there, and there will be hyperinflammation, okay, and patient will suffer from inflammatory bowel disease. So the immune system, or mistakenly it attacks our intestinal mucosa and will cause a persistent or continuous inflammation into our gut, okay. Next factor we have environmental factors. So environmental factors will trigger the inflammatory bowel disease, okay. So in environmental factor we have high fat, okay. So if we take a lot of fatty diet and oily diet, then what will happen? The fat get oxidized into our body, and this oxidation leads to the inflammation of our bowel. Next we have high sugary diet. Next we have low fiber, if we are taking low fruits and vegetables in our diet. Next we have excessive pollution and chemical fumes, and more hygiene, okay. More hygiene means there is a hygiene hypothesis theory about inflammatory bowel disease. It means in excessive hygiene, what happens? Our immunity does not develop in excessive hygiene, okay. So it is given in hygiene hypothesis theory that excessive hygiene is also decrease our immunity. Next we have defective intestinal barrier, means leaky gut concept. If this intestinal mucosa get leaky, okay, if this intestinal mucosa get leaky, then what will happen? Our immune cell will attack our intestinal bacteria, okay, and there will be inflammation. How? We have trillions and millions of bacteria into our gut system, okay, and our intestinal wall is in an intact form, okay. If this integrity or this intactness is break down, okay, the gut become leaky, then what will happen? The viruses, the bacteria which are present into our gut, they will release into the bloodstream, okay, and our immune cell will attack to those bacteria, okay, and then slowly patient will develop inflammatory bowel disease. Next we have altered gut microbiota, that is dysbiosis theory, okay. In our gut we have some good bacteria and we have some bad bacteria, okay. If there is a balance between good and bad bacteria, then it is okay. But if by chance bad bacteria increases into our gut system, then the immune system will get activate there and it will cause inflammatory bowel disease condition. Now let's come to the risk factor, okay. These factors will increase or exaggerate the inflammatory bowel disease condition. First factor we have age group. So people who belong from 15-35 years of age, they are more prone, and second peak incident is about in 50 to 70 years of age. Next we have family history, okay. If first generation or first parent, okay, or siblings are suffering from inflammatory bowel disease, then there are about 20% chances that their first generation will suffer from inflammatory bowel disease, okay. They are increasing the risk of patient for inflammatory bowel disease, okay. They are not the causative factor. Next we have smoking. So it is seen in various research that people who used to smoke, they have less chances of ulcerative colitis, means it is doing a protective mechanism in ulcerative colitis. It means smoking is good for the people who are suffering from ulcerative colitis. It does not mean that we suggest the patient to start smoking, because we all know that smoking is very injurious to health, okay. It will cause another disease condition or many another disease condition into our body, okay. And smoking is very harmful in Crohn's disease condition, okay. People who used to smoke a lot, okay, they develop the Crohn's disease condition. Next we have stress, okay. So stress level will also exaggerate the inflammatory bowel disease condition. Next we have medication, okay. Certain medicines like we have NSAIDs, non-steroidal anti-inflammatory drugs, painkillers and antibiotics, okay, they decrease the immunity power, okay, they decrease the immune system, okay, and certain oral contraceptive use. Next we have ethnicity, means certain age group people who are from Europe country or who are from American country, or the people who belong from Ashkenazi Jewish descent, okay, they are more prone for inflammatory bowel disease, okay. It is seen that people who live in urban areas, okay, who have excessive hygiene condition, and the people who are white, okay, they have more chances of developing inflammatory bowel disease. So next we have pathophysiology of inflammatory bowel disease condition. So how this disease condition occur into our body, okay. So genetic is not only responsible for causing the inflammatory bowel disease. There are so many other factors which will also do the inflammatory disease condition. So if any person is genetically susceptible for IBD, or he is genetically predisposed with the fault gene or mutation gene, then what will happen? He will have IBD, okay. He is more prone for the IBD disease condition. How? Because some genes regulate the immune system, okay. Some genes in genetically predisposed person will regulate the immune system, okay, which will make our immunity which will make our immune system as a hyperactive immune system, okay. Due to the overprotection of immune system, it will lead into the hypersensitivity of our immune system. And it will also decrease the intestinal barrier protection, okay. These genes will also decrease the intestinal barrier, or they will decrease the protection factor for our intestine, okay. Next, these genes also recognize the bacteria easily, okay. So they will attack, so due to which our immune system will become hyperactive, okay. So if any person is genetically predisposed, or he is genetically susceptible for IBD, then there are more chances that he will develop IBD disease condition, okay. Not only genes, but there are some other factors which are also responsible, like environmental triggers. So in environmental triggers, we have like smoking, dietary factors, alcohol consumption or stress factor, and using of lot of antibiotic drugs, okay. These all factors will also trigger the inflammatory bowel disease condition. Next, we have altered gut flora, that is dysbiosis, okay. So we have some good bacteria and some bad bacteria into the lumen, okay. Lumen is a free space into our intestine, okay. So suppose this is a free area of our intestine, that is known as lumen. So bacteria are mixed with the food, okay. If by chance these bad bacteria is increased into our lumen, then what will happen? Our immune system will get hyperactive, okay. And due to the hypersensitivity of our immune system, the IBD disease condition takes place, okay. So how this disease condition is occurring into our body, okay. So due to all these multifactorial factors which we have read, like genetic factors, environmental trigger factor, hypersensitivity of our immune system, and the increased amount of bad flora into our lumen, okay. So these all factors will do the permeability, okay. They will increase the permeability of our intestine, okay. Now due to all these factors, what will happen? Our intestine permeability will increase, okay. Our intestine will become very leaky. Now when our intestine will become very leaky, the holes and the gaps will present into our intestine now, okay. Now what will happen? These bacteria which are present in the lumen, they will shift, or they will move towards the mucosal tissue, okay. They will move towards the intestinal wall tissue, okay. Now these bacteria which are present in the lumen, they have moved to the intestinal tissue, okay. Now this bacteria will release some kind of toxins, okay, and they will penetrate into the intestinal tissue. Then what will happen? The cell mediated immunity, or the innate and the active immunity, will generate over there, okay. So the bacteria are now in our intestinal tissue, okay, due to which the cell mediated immunity will generate over there. And this intestinal bacteria which are in tissue, they are misidentified as a harmful substance, okay. So what our immune system will do? They will think that these bacteria are harmful, they are the antigens, or they are the foreign particle. So our own immune cell will attack to our own gut bacteria, okay, which are not harmful, but they are thinking that it's very harmful. So immune system will dysregulate there, it will become overactive there, it will become hyperactive here, okay. So intestinal antigens are misidentified as harmful. Now lots of immune cell will gather over there, okay, like we have macrophages, lymphocytes, lymphocytes, WBCs, and T helper cell, okay. And this all immune cell will activate our CD4 T cell, okay, due to which lots of immune cell will come over there, and they will also activate our CD4 T cell. Like in Crohn's we have CD4 like Th1 and Th17. In ulcerative colitis we have Th2 CD4 T cell, okay. So they have other types of immune cell, okay. So these immune cells are hyperactivating the CD4 T cell. Okay, now this CD4 T cell or T helper cell will release some types of chemicals over there. Okay, they will release some inflammatory chemicals at that area, like we have cytokines in that area. For example, we have transnecrotic factor alpha, we have interleukins like 1, 6 and 12 and interferon gamma over there. Now this all chemical mediators and this all cytokines will do the destruction, inflammation and ulcer into our intestinal wall. Okay, and they will also do the swelling, pain and abscess and formation at that intestinal area. Okay, due to which the patient will develop the inflammatory bowel disease condition. Okay, so he will have a chronic intestinal inflammation that is known as IBD.